Hey.
Hey, what's up? Good to meet you. So, we got a call from the hospital lawyer.
Oh, yeah, I heard that. Yeah.
So, I personally don't have any problem with things being recorded because I'm only going to give you good advice. So, I wanted to talk to you about how to handle this situation so that everyone is comfortable, because you need care, and you need care here.
Yeah, and I had heard the same thing from my other physicians. Everybody said the same thing you did.
Yeah, so
it didn't really make much sense to me when the lawyer communicated to me initially.
Yeah, I think some of
because no one had said anything to me, and they had definitely expressed initially that there wasn't a problem.
Yeah,
I don't really understand.
I'm personally okay with it, but there may be, what I wanted to talk to you about this is that there may be physicians or practitioners that may not be comfortable with it, and if that's something that you wanted to do,
I'd like to know which ones are and are not, because
I want to give you some strategies. So I think if you started out, like, do you mind if we record this session so that I have it for my own personal use at the beginning of the session, and that would make it more comfortable? Like, if you said that to me, I was like, sure, absolutely. I've actually had people...
Because I know, I'm pretty sure I talked to you about it years and years ago. It's been a long time, so I wasn't sure
honestly, I don't remember.
Policies had changed or anything, but I'm pretty sure I did it before I had the scope.
Yeah.
You know, for like when we were doing all of that with Gastro here, that's when I know I made sure to speak to y'all about it and to speak to the surgical team about it because I needed it for MD Anderson.
Yeah.
Because MD Anderson had always taught me to do that.
Yeah.
And then before surgeries and stuff, just for me, because they didn't expect me to ever not have seizures and things like that.
Yeah.
In and before the appointments. I mean, like, there's been appointments where I've been at the neurology clinic at LSU. With Dr. Lenajek, and I've had seizures there, and I don't really remember what happened in the appointment and stuff. So it's like there's medically necessary reasons, and no one's ever seemed to have much of an issue.
There's a couple things that I want to bring up so that we're all on the same page. Your health information is protected. It's protected by federal law.
Yeah.
And you can give that information to anybody that you want to, but the hospital system has to legally protect that information. So it probably makes lawyers uncomfortable when that information is being broadcast. It makes them uncomfortable unless you've released that information, if that makes sense.
I know I've given a release to LSU, given a release to MD Anderson, given a release to Ochsner, and I've given a release from MD Anderson to Ochsner to here, to LSU. I don't know if there was a requirement to do another release in the past year whenever there was changeover with Tulane or whatever's been happening with that. I'm still not sure what the situation is with that.
I'm not really sure what
so
the
I don't really know if I
is
need to sign
either,
it.
I don't have all the intricacies of...
Because I did do that at one point. There was a special media release, and I signed it online on the patient portal.
I think the special concern was that it was being put online. And so when that happens, the hospital and the practitioners may feel as if they may be liable for your health information being broadcast.
I was always under the impression that as long as I was explicitly the one that did it,
we're in a weird time in society in that we have a lot of technology that the laws haven't caught up with. So what people try to do is not run afoul of laws or become the case that creates new laws, if that makes sense.
Yeah, I agree with that. I understand that. I don't want to be a negative precedent setter for jurisprudence. I don't want to do that.
And you are our patient, and I will take care of you until you don't want care anymore.
Thank you. I appreciate that.
So that being said, what I would suggest going forward is if you wanted to do that, particularly if you're going to broadcast that out into the larger community, is that you ask if that's okay with the practitioner, and then respect them if they don't want to do that.
There's enough practitioners here to where I can probably request a new one if they're not comfortable with it.
I think that's a great plan.
I was just kind of blindsided because I definitely did get explicit
that's why we wanted to have a conversation with you and make sure that we're on the same page.
I don't think that my other physicians were spoken to before actions were taken against them by the lawyer.
Speak to that
I don't know either way because I wasn't talked to, but I don't think anybody was really
I was just notified and they said, do you want to see this patient? I said, absolutely.
Was that recent or months ago?
A few weeks ago.
A few weeks? Yeah, because there was stuff that happened 2 months ago, maybe 3 months ago, and it happened like without me knowing.
Yeah.
So like it just kind of seemed like it happened almost externally and like automatically. And once it happened automatically,
And there
it was
may
like
be
too
a
late.
policy, but I haven't been made aware of the policy in regards to the transmission out into like a Facebook or a YouTube or anything like that. So I don't know if there is a policy. I have not personally seen the policy. That would be something to be I'd be interested in seeing myself.
Because I always used YouTube because I was most familiar with the like broadcast laws and stuff like that, and because I had always had a professional setup with them.
Sure.
And because of education setups, because of LSU and when I was in high school and stuff, Google and Alphabet were the ones who had the federal contracts.
Yeah.
They had the medical contracts too. So like we had to like during biomedical science classes with like LSU, we would watch like their live streams and stuff and their discussions about like ethics and things like that for class and coursework. So that's kind of why I always kind of stuck with them personally. I never used like Facebook and other things because I don't know, just it didn't seem like they were like prioritized towards
I get it.
that. But I don't know if something changed with that. Maybe they'll change over the contracts or something.
I don't know. But my message to you is that
to look into
we're
going to
keep taking care of you regardless. If you want to record the conversations while we're having it in the clinic, I'm perfectly okay with that.
Great, because I don't have any intention to harm like y'all or like at all.
Because that undermines our ability to work together.
Yeah, exactly. It's just a way for me to make sure that I'm taking accurate notes.
I would request that you talk to every one of your practitioners this way. So if you are doing that, it's above board and everybody knows it's happening.
Okay. Is there any way to like to add that to like my file or something?
We're actually going to record in the note that we've had this discussion, that you are aware that this is health related information that's protected, and that you're essentially waiving your right to that protection by putting it out into the world.
You mean like protection by like the hospital enforcing against it, or like protection by like?
I don't speak for the hospital, so I can only say what from.
Because I certainly don't mind waiving the right to like bring suit against like the hospital or like any individual physician if that means I get to like have the most documentation
that is
and stuff.
Well above my pay grade, and that would be a discussion with the law team here at UMC and the parent company LCNC in particular. There's benefits for you doing this for other people.
That honestly has always been kind of the biggest part of it, is because of my rarity and stuff like that.
Is that there are federal laws in place that make this a tricky landmine-filled problem for practitioners, physicians, and hospital systems.
Yeah, when I learned about it, I was 10, so there was a lot more protections on me as a patient because of
being a pediatric patient.
Well, actually, I was considered childhood. I was so young, so like there was even more stuff to where it most of this kind of like legal landscape, it was like I felt like it was there, but it just didn't seem to like exist.
17 years ago, yeah, for sure.
Yeah, really. So like, and now I'm realizing I'm like, I didn't even 17 year thing. That didn't sink in for me until a few months ago when I followed up with a nurse who came to my house to talk to me about primarily a children's hospital and the initial treatment and stuff. And I'm kind of like, wow, it's been such a long time that I'm like such a record holder with being alive with this cancer that
I don't know. Why I don't want to compromise your care.
It's kind of. It's like I have to actually follow up with these things again. I can't just keep acting like I'm still in high school, kind of a deal.
Yeah.
Just because like, I mean, like my main oncologist, who was at Children's Hospital, he was the one heading the sickle cell research that they had at the White House a few years ago. So like, they're kind of like, I guess things have just enough time has passed and I haven't really caught up, and I'm just trying to make sure I do that.
That's prudent, and we're also trying to be prudent, and we're not going to not see you because of this situation. And what I would suggest is when we finish this out, if you need to make some sort of legal arrangement with the hospital, that would be prudent to do as well.
How would you suggest I do that? Because I don't really know what to do.
I will go back and get you a name and a number, and I'll bring it back to you.
I really appreciate that. Thank you.
That being said, I'll let Dr. Hall get back to what he does, and I'll come and get that information for you. Sound good?
That sounds good.
Great to see you, man. Happy New Year.
Nice to meet you.
Yeah, please do. Okay.
Your HEMOC appointment, by the way, they scheduled for February the 3rd at 1 p.m. And that's with Dr. Bonet.
Oh wow, they got me in really early. Yeah, no, that was my fault. I walked past the checkout again. And I just left. So I'm trying to be better about that, but I do that.
And that one's scheduled. Now the others, you had some others that were maybe previously scheduled, like with.
Yeah, I guess I'll just call back and I'm not really sure what I should do.
Give you the number, and I think probably the best course of action will be to reach back out, because they may just want you to sign some like release or something for information.
Yeah,
as simple as that. But
I don't mind just moving past everything.
Now you're
fine with me.
Let's get to your medicines. So last time we'd seen you, it's been a little while. You were still having some of that abdominal pain, but it had basically improved with dental. Were you still taking the dental?
Yeah, it got worse.
Okay.
And then I to where like in the prescription itself, I think was written for a strength of like whatever the strength is. I don't know what in milligrams it shows there, but that was filled to where it was one pill is one dosage. Yeah. And I remember it had been initially like, I don't know if it was equal in milligrams, but it had been 2 pills like 2 times or 3 times a day, and so it probably was a much lower dosage in milligrams. But whatever the milligrams is currently now, as written, I've been having to take at least like November and maybe October, 2 individual pills for a dosage, sometimes twice a day, for those 2 months.
So the 20 milligrams. 2 pills.
2 pills is 20 milligrams twice a day then.
Okay.
For like around then, and then in December, I got the I'm not sure if it's connected or anything, but I got the lidocaine patches refilled again that I had not been remembering to ask Dr. Lennon to get the prescription just sent back in, because I hadn't been using them like I was directed to by my orthopedist at Children's Hospital. I was supposed to be using them almost every day, but I just like, if I was going to do any exercise, I was supposed to always use one, but I had like never done that, and I ended up causing like a secondary surgery follow-up because of my
when was this?
like re-injuring myself. Like 2019, 2020. 2020 was my last surgery with them, with Dr. Gonzalez, and their team there. It just took quite a while, and a lot of it was because of that. I was supposed to be like having some sort of a medication on top of the injections they were giving me to make sure that I could actually like properly actuate like the ball and joint and lift stuff like that, like I'm doing now. But like now when I kind of have been trying to lift weights in like December, I had the patches, and I noticed that when I would use that, I was having a lot less pain overall the day.
Okay, good.
And it felt like, and because of that, it seemed like I dropped down to 10 milligrams of the dicyclamine, and I wasn't having as many like spasms, because I was having kind of like, I was trying to do the exercise in like November, and then it was I don't know if I was just like the stomach pain too, but it was like a lot of pain.
You're now the dental you're taking, is it twice a day every day, or is it kind of?
It's been like twice. It's been
like twice a day, a few days a week.
Once a day, but I've been getting better results from it being the 10 milligrams twice a day typically, but pretty spread out. Sometimes maybe into the next day almost.
And then how are you with your bowel movements? Is it still?
It's been better in the last month, I'd say. It wasn't good at all in October or November, so I just don't know if I got sick or something, but it was just not a very good time.
It can fluctuate, like we talked about last time, but
there weren't like, it wasn't bloody stools or anything like that, but it was painful.
Now, do you feel like like previously, I know you'd had some issues at home and whatnot, and you felt like that may have been contributing to some of those GI symptoms. Is that still ongoing?
Yeah, yes and no, maybe. I still am, definitely, but a lot of that's taken a backseat in the last few months. I mean, there's still been issues with my mother, but they haven't been so present to me because I live in a condo now. My family purchased a second property, and I'm the one who lives in that. And my father finished his disability case with Social Security for Alzheimer's, and he's retired now.
Okay.
So it seems like there's still been issues, but my family's kind of been avoiding me completely, and that's been, if that's gonna happen, that's been, I guess, less stressful because there's just less interactions and stuff like that. As unfortunate as that is, it's just like they didn't have me over for Christmas this year, but that didn't really contribute to any stress. That was kind of a relief almost, and I just spent time with like friends.
Okay.
So like, but whereas like last year, like not this past year, but like 2023. I was there, and it was like it was a really that was definitely, I think, a contributing factor for sure. That was probably the worst we've had on date.
Difficult situation.
It is, but then it was 9 months or so until they got the case in with Social Security, and they got it in pretty fast. And I guess the stress, I don't know, is my mother's still really not handling things, but at least it's not as much to me. She still comes over multiple times a week sometimes, and then is probably
not to the
level it used to be, So like it seems like there's distance between us, and that I think is helping a lot.
Now your diet, has that improved?
That's been a lot better.
Good.
I've been getting a lot more educated on what to do with cooking and things like that. I got on Snap. So I have like a food budget kind of. It's still not good diet, but it's like a lot more calories.
Were you able to start that Remeron through your app?
Yeah, I mentioned it there. We had spoken about that like a couple years ago because I had been on it for like that whole month, and it didn't end up it stopped causing me to be drowsy and stuff like that, and it didn't show any like efficacious signs or whatever. So like I was taken off of it. I had it added back on accident, like half a year ago or so, because I don't think I remembered whether or not it should have been there.
Here we go.
And then they filled it for me, and then when I got it at the pharmacy, I was like, oh, right, this was the medication I was supposed to have stopped taking.
Yeah, I think that we had discussed resuming it.
Did we? Okay, maybe that was what confused me.
Yeah, because you were on it previously, but there was...
Because I had spoken to Dr. Lenajek about it, and it had seizure concerns with it.
Okay.
And I don't think I have no idea if I even mentioned that to y'all.
Yeah, I don't think we...
My seizures were worse whenever I did discuss that with Dr. Lenajek, and I was going back through my notes and things.
Yeah.
And I was like, oh, I probably should talk to Gastroenterology about this.
Yeah, I mean, obviously there's concerns.
It was like a small, but it was like listed as a
lowering the seizure threshold.
Yeah, and the last medication I was on that lowered my seizure threshold, Wellbutrin, also had that, and that was causing me to almost have like a stroke-like symptoms. So.
I think.
But that was like 4 or 5 years ago.
And honestly, it seems like your symptoms are much better than where they were last time we saw you. GI symptoms anyway. So I don't think that that's absolutely necessary to resume, or if we even really need another medicine right now, because it seems we've kind of got everything pinned down.
Desoclamine really has been a saving grace. It's honestly extremely effective.
I'm assuming you need a refill for that.
Yeah, I don't know if it needs to be written in a different way to adjust for potentially 40 milligrams a day of it, but that's probably...
Yeah, the prescription will just, if it changed...
Because I've been getting contact from the pharmacy that my insurance was saying that the medication itself wasn't due for a refill, but I think that was because of how it was written.
Yeah, I think it was written as 10 milligrams.
Yeah, it probably just needs to be
3 times daily.
I'm pretty sure they're gonna cover it.
Take it 3 times daily, like we discussed. You can take it as needed, or twice daily, obviously.
Yeah, I hope I don't have to go much more than that, but it.
Yeah, I think the diet we use is kind of the main thing that we talked about.
Yeah, I don't know if I've I'm supposed to stick to certain types of foods or something,
so the
but...
other thing I think that would be helpful with you would be keeping what I call a food diary, which kind of sounds like a pain, which...
I've been doing that.
You got perfect.
Well, kind of. I've been pretty good about taking Snapchat videos of my, like, what I'm about to eat, and then just putting it on, like, the Instagram story for that day with the date, time, and, like,
Is that something that you can reference easy? No pain when I'm pressing it.
It depends on, like, yeah, I could look through it.
Okay.
Most of the, haven't been as good with, like, each individual item, but it depends on how detailed you want it.
Any, no leg swelling or any new lumps or bumps anywhere?
Swelling on the left ankle and left foot, but that's not today, but earlier this week.
Yeah, I mean, as long as that's something that you can reference easily, but...
I could make it more easily.
But maybe you keep it in your phone, like notes in your phone, and what I tell most people to do is, at least for the initial couple of weeks, keep a diary of everything that you've ate, and it doesn't have to be crazy detailed with all the ingredients or anything, but and you can write down symptoms, like if you have abdominal pain or bloating or diarrhea after certain meals, and then after you do that for like a month, 2 months, you can really pinpoint the exact things that are causing most of the trouble, which for you, like we know, dairy products or lactose in particular has been an issue.
I've pretty much cut all of that possibility out of my diet, but I've also added a lot of other new things.
Sure.
So
and that's good.
I guess
that would be the only other thing.
Yeah, I can do that, and I can give you the results from that.
Yeah. Sounds good. Anything else today?
Oh, I wanted to ask about like dietary supplements. I've been trying to get back into endocrinology, because I was supposed to have done that in high school, and I in transition to like an adult endocrinologist, for my pediatric one for growth hormone and other hormone stuff, because I was on human growth hormone replacement therapy, and I was always supposed to have been for the rest of my life on some sort of a hormone, but then everything kind of changed with hormone stuff, and then they just kind of were like, we're going to table it for now, and you need to get with an adult practitioner to follow for like the rest of your life, because you can't continue here type of a deal. And
so you don't
then
have,
that didn't
you don't
happen.
Have an endocrinologist, okay.
Yeah, so I'm trying to get in with that, but I had been looking at the like the vitamins and supplements and things to try to figure out what I was prescribed back then, because I was prescribed something, and I looked at it, and I'm pretty sure from the records from Dr. Powell, it was like DHEA, and I don't know what dosage it was at, but I did want to ask, is there any like that you know off the top of your head of like like a vitamin supplement at a low dosage for that causing any gastroenterology problems?
Not off the top of my head. Now, most of these supplements and over-the-counter medicines all have varying GI upset, nausea, vomiting, diarrhea, and that's because if they do these big clinical trials and one patient has these side effects, then they have to list them, right? So that's almost every medication or supplement ever. Now there's some more prone than others, like different classes of medications. One that we see all the time is things like ibuprofen, Aleve, all that stuff. But as far as like vitamin supplements, none off the top of my head. I might have to think about it, but definitely none that you're taking now, or any that I would tell you to avoid, especially given your history.
Okay, then I'll continue on with that. I just wanted to make sure.
Yeah.
I'll probably get a prescription for it version once I get into the endocrinologist at whatever appropriate dosage, because I'm sure the one that you can buy over the counter that I got was probably like way too low, but
safe to say. Now you're who's your primary care
I just wanted to make sure to
doctor?
check up with that. Dr. Callie Ann Linden.
When are you gonna see her again? Do you know?
I don't know. I will probably have to contact.
Yeah.
I'm not really sure. She scheduled me for like a couple months from now.
Okay.
But I already contacted through the patient portal their office and requested another annual because it's the new year and like I can do that. I actually didn't have an annual last year for some reason, so like it's what it said on the patient portal. So just I'm sure her nurse will have it, so I mean they'll probably figure something out.
I forgot to ask you this. Same pharmacy, Mandible.
Yes, that's where I transitioned all of my medications to. I was having issues with Walgreens, but the Mandeville's been able to work everything out.
I'm going to take the Remeron off of your...
Okay, thank you. Because they keep automatically refilling it there, and I just wanted to make sure.
And then I refilled the bentyl at 20 milligrams. I listed it as 3 times daily, which would be the max that I would want you to take it, but obviously less is more there, so I would only take it if needed. Or if you get to a regimen like you have now, where you're taking it twice a day, that's appropriate as well. I think that's it.
I'll try to stick to 1 a day, if possible.
Whatever you can do. And then the food diary would be helpful. Obviously, you don't have to go crazy with it, but I think it would be...
Is there like a way that I could give it to you that adds it electronically for you, like just so I know for a file type or something? There are a lot of different things I can do just on my phone. Typing something in, they can automatically export it. I have a background in software engineering, so it's pretty easy for me to kind of do something as long as I know ahead of time.
Yeah, I mean, that, or you can just keep it on your phone, we can look at it, go through it together, your next visit, whatever's easiest for you, doesn't matter.
Are you sure? Because, I mean, it's anything you know just for, like, how you've done stuff with Epic's, like, systems before, if you just have, like, a preferred, like, I don't know how they import stuff works, but...
Because it's mainly for us to, like, I just want to go through it with you, and if you want to do that through Epic, like, I don't know how you would do it. Epic, but
have you ever requested this type of a thing from another physician before? Okay. That would have told me a lot. That's okay.
Most of the time when I have them, it's just through, like, people will do a notebook, or they'll keep it in their phone, and then we'll go through it together.
I can do that, yeah. I'll probably have it in, like, a text file or something.
Yeah, that's fine. I mean, that's fine.
Something simple like that.
We can review it, but let me go get everything else sorted out here, and then I'll see if he has that number for you.
Okay.
And then we'll get you out of here. I'll be right back.
Okay.
can't tell if Dr. Lennon's appointment got canceled or not.
Yeah, I didn't get any emails about cancellations or anything. It just kind of like disappeared.
I've got another primary care physician here that we work with on a pretty routine basis, and if it's okay with you.
I'm fine with being referred out, but I'm not sure if I'm allowed to because Medicaid. Oh, because
it's just a different.
Yeah, but with Medicaid systems, they assign me to someone, and they assigned me to Lyndon, and she has a contract for 60 years on my Medicaid portal, and my previous physicians only had like 6 months or so, so I don't know if they're going to have to approve it first.
From what I'm seeing, it looks like that you've potentially been discharged from that clinic. Now, I'm not sure.
But I'm not sure if I've been discharged from her as a patient. That's what I was kind of confused about.
Yeah, and I'm not sure either. It just, from what I'm looking at, it says cancel.
Because
discharge.
Medicaid typically seemed like, at least from when they spoke to you on the phone and stuff, like that it was impossible for you to not be with the same primary care until they got involved.
Yeah, again.
So, and I'm not sure if they have gotten involved. They haven't talked to me either, so I don't.
Probably not, but again,
I'm fine with the referral out because I can then use that to talk to Medicaid with. Okay. I'm assuming.
Yeah, so I'll send that and then.
Will they contact me or something?
Yeah, they should.
Okay.
They should.
All right. After they do that, I'll speak to Medicaid about it, I guess. Because I do have to, I believe,
I think first
get it through the federal portal.
First, what I would do is I'll send this message and see, and then maybe you can call Dr. Linden's office, or maybe after you speak with Brandy about, whatever the issues may be with that. Then we'll have a better idea of like, okay, what clinics are we going to now, which are we not? Just because I don't want you to fall out like primary care. He needs vitamin C, so. I'll at least send that message to her, and if nothing comes of it, then that's fine, no worries. But it could be a potential resource, just in case. So, anyway, I'll send that. You have that number, and then I sent you those refills today, and then you should be good to go.
And so she works on site?
Yeah.
Okay, so I wasn't sure if this was like, just a signature line on an email or something, or sent by, just a law firm.
I don't know where he got the info from, but if that's Brandy. Yeah, she's here.
Okay, I just want to make sure. Yeah, because LSU didn't know for sure either when I contacted their IT about something else.
So she's LCMC specifically.
Okay, because I was reached out to by LSU as well, and I'm not really sure in what capacity, like why that happened, but that it seemed like it was almost connected, but maybe it wasn't. I'm not sure.
Yeah, LSU and LCMC work together.
Maybe
that
I don't
know like who's contacting who on their behalf,
Yeah, their IT told me to like disregard it, so I'm assuming it was probably there's enough interconnectivity that it's probably just kind of a jumbled mess.
Probably safe assumption, yeah. But who knows? Either way, I'll send that message. And again, if nothing comes of it, or if you can get plugged back in with Lyndon, that's ideal. But
is that your photo from like when you were like a resident?
Yeah, I got that one 6 years ago. Yeah, 6 years ago, and then that was the same one, didn't it? Yeah, that was my other one. I don't remember when that one was. I guess that would have been.
Does my photo pop up on my portal?
3 years ago. Yeah.
Is it the same photo from MD Anderson?
Oh no, I didn't see MD Anderson.
Oh, you didn't. But the photo looks like you've seen me. Like I look like I'm older and stuff. I was just wondering because like.
Didn't pay much attention to it.
I don't think that it shows that on my patient portal, and but it definitely, when I log into like the MD Anderson patient portal, it's right there on like the left, and it's the same place the photo they took of me in like 2008, my first surgery.
It's probably the same one. I'm guessing.
I was just wondering if that was what popped up. It's not that relevant. I just.
Yeah, I don't think I've updated any of my ID pictures.
I think that's the same one that shows on our patient portal, at least for our check-in. But it might not show any image, I'm not sure.
Yeah, 6 years ago, man, time flies. A little too fast.
Oh, I checked the patient portal to see if I could find a way to, like, submit something for the food thing, for the food diary. I didn't find anything that I could.
Yeah, I mean, like I said, I've never...
There was only connections that I could make from other places, and I already have connections made.
Like, I've tried it a few times, but my IT knowledge is, I'll say non-existent.
Yeah, I'm not in IT either. I don't really know what to do with them.
One of it lets me zoom in or what?
Oh, that's the one I had at Auctioner.
Yeah,
That was
my
senior year of high school.
I just wondering. Yeah. It used to be a teeny little type like that, so small, and so, like, just before I started the infusions, I looked very different. Yeah, 10. Yeah, when I was first diagnosed, yeah. Started the infusions, the 2 weeks after my birthday.